Today we will learn the 8 principal syndromes. My name is Hu Ying. I'm with the TCM department of Sengjing Hospital. The 8 principal syndromes. The 8 principal syndromes include yin, yang, exterior, interior, cold, heat, deficiency, excess. Among the 8, yin and yang are the most important syndromes. Differentiation of yin syndromes and yang syndromes is of theoretical significance. It gives information about the general character of a syndrome, but no concrete treatment can be determined merely based upon a diagnosis of yin or yang syndromes. Yang syndromes include exterior syndrome, excess syndrome, and heat syndrome. Yin syndromes include interior syndrome, deficiency syndrome, and cold syndromes. The other 6 parameters are at the secondary level of importance. In some cases, diagnosis can already make treatment possible, but can't serve as an independent guiding principle for the classification of syndromes. The other 6 parameters, different aspects of a syndrome, exterior and interior indicating the depth or location of the disease, cold and heat indicating the nature of a disease, deficiency and excess indicating the confrontation between the body resistance and the pathogenic factors. For example, a syndrome may be exterior in location, cold in nature, and at the same time have an excess of pathogenic factors. Only in typical cases can parameters be distinctly determined. In many other cases, pairs of syndromes are involved together, the exterior and the interior, deficiency of normal qi and excess of evil qi, interlocking of cold and heat. In addition, the parameters may change in the course of a disease. For example, an exterior syndrome may turn into an interior one. A cold syndrome may transform into a heat one. An excess syndrome may become a deficiency one. Exterior versus interior. Exterior syndrome. The invasion of exogenous pathogenic factors usually cause an exterior syndrome at the early stage. The common clinical features of exterior syndromes are chills and fever, headache, aching of the body or joints, thin coating on the tongue, and floating or superficial pulse. Since the lungs are closely related to the body's surface, exterior syndromes may also include upper respiratory symptoms such as stuffy, running nose, sore throat, and coughing, according to the nature of exogenous pathogenic factors and the response of the human body. Exterior syndromes can be classified into those involving exterior cold and those involving exterior heat. Exterior cold syndrome, chills with mild fever, normal tongue with thin white coating, no thirst as well as floating and tense pulse. Exterior heat syndrome, fever with mild chills, sometimes mild thirst, reddened tip of the tongue, thin white or yellowish coating, as well as floating and rapid pulse. Both of the above syndromes are of the excess type. They usually occur in previously healthy individuals with no deficiency or normal qi after an attack of excessive pathogenic factors. Exterior deficiency syndromes, chills and fever, aversion to wind, spontaneous sweating, floating, and feeble pulse. The distinguishing features for differentiating exterior deficiency syndromes from the exterior excess syndromes are spontaneous sweating and feeble pulse. It should be noted that local disease of the skin and subcutaneous infections don't present to exterior syndromes. They are called external syndromes. Interior syndrome. Interior syndromes associated with disease of internal organs may be caused in any of the following 3 ways: transmission of exogenous pathogenic factors from the exterior to the interior, direct attack of exogenous pathogenic factors on internal organs, dysfunctioning of internal organs due to internal injuries, transmission of exogenous pathogenic factors from the exterior to the interior. For instance, following an exterior syndrome with chills, fever, headache, and floating pulse, the chills disappear and a high fever occurs accompanied by dyspnea, expectoration of yellow sticking sputum, chest pain, thirst, reddened tongue with a thick yellow coating, and forceful and rapid pulse. This is an interior syndrome due to the transmission of pathogenic factors from the exterior. Direct attack of exogenous pathogenic factors on internal organs. For instance, catching a cold results in vomiting, abdominal pain, and diarrhea, indicating that the stomach and the spleen are affected. It is a syndrome of direct attack on the interior by cold. Dysfunctioning of internal organs due to internal injuries. For instance, emotional turmoil can result in headache, dizziness, bloodshot eyes, tetanus, triggering rapid pulse, and reddened tongue with a yellow coating, indicating hyperactivity of the liver. It is a syndrome of liver failure. The key points for differentiating exterior syndrome from the interior syndromes are as follows. Most exterior syndromes are caused by exogenous pathogenic factors. Exterior syndromes occur at the early stage of exogenous affection and last for a short periods of time. Then they are either cured or transformed into interior syndromes. The common manifestations of exterior syndromes include chills or aversion to cold, thin coating of the tongue, and floating pulse. Among them, the presence of chills is of crucial importance, as it is commonly said, so long as chills exist, the exterior syndrome is there. Interior syndromes are characterized by dysfunction of internal organs. If there is fever, it is not accompanied by chills or aversion to cold. Other symptoms of interior syndromes are extremely diverse, as different internal organs may be involved. In addition to those mentioned above, there are two other categories of syndromes which may be related to both the exterior and the interior. One is a syndrome due to an affection located between the exterior and the interior. The other is a syndrome due to the affection of both the interior and the interior. Thank you.